So, if you're a student trying to get your head around cancer, it can feel, well, just massive. It helps to think of it less like one single disease and more like a giant, sprawling family tree with hundreds of different branches. And today, we're going to make sense of that tree. We're breaking down cancer classification, the system that doctors use to understand every single branch, figure out how it's going to behave, and most importantly, how to fight it. So, what's the deal? Is cancer one thing, or is it hundreds of different diseases? Well, it's definitely the second one. And that is exactly why classification is so important. Knowing the precise type of cancer tells a doctor everything, from what treatment to use to what a patient's prognosis might be. This isn't just about passing an exam. This is the absolute foundation of how we treat this disease. If you're studying medicine or biology, this is square one. Okay, so here's our game plan for this explainer. We'll kick things off with a single most important question you can ask about any cancer. Then we'll dive into the two heavyweights of solid tumors, carcinomas and sarcomas. After that, we'll cover cancers of the blood and nerves, add a few more layers of detail to our understanding, and then we'll wrap it all up with a super quick, high-yield review of the facts you absolutely have to know. All right, let's dive right in. The most crucial point, the first question you always ask is this: what type of cell did this cancer originally come from? We call this classification by histogenesis, or cell of origin. Everything else we talk about is built on top of this one idea. If you only remember one thing today, make it this. And you know what's amazing is that this one question really simplifies things a lot. Just look at this chart. That enormous piece of the pie, representing about 80 to 90% of all human cancers, all starts from the same basic type of tissue. These are called carcinomas. So statistically, these are the cancers you're going to see and hear about the most, which is why we're going to tackle them first. Okay, so let's pit the two titans against each other, carcinomas versus sarcomas. Nailing down the differences between these two is one of the most important concepts in all of oncology. And this slide just lays it all out, nice and simple. On the left, you've got carcinomas. They come from epithelial tissue, the stuff that lines our organs and glands. They are by far the most common, and here's a key point. They tend to spread through the lymphatic system. Now, look to the right, sarcomas. These guys are different. They arise from mesenchymal or connective tissues. Think bone, fat, and muscle. They are super rare, but here's the kicker. And this is a classic exam question. They spread through the bloodstream. Let's make this real. The names actually give you clues. When you see the word adenocarcinoma, your brain should immediately think gland, which is why you find it in places like the lung, colon, or breast. See squamous cell carcinoma, think flat, surface-level cells, like in your skin or esophagus. And no surprise, transitional cell carcinoma comes from the special transitional cells that line your bladder. And hey, the naming for sarcomas is just as logical. It's almost like a cheat code. Osteo means bone, so osteosarcoma is a cancer of the bone. Lipo means fat, so liposarcoma is from fat cells. Leiomyo means smooth muscle. Rhabdomyo is skeletal muscle. And angio means vessel. You learn the prefixes, you know the origin. It's that easy. All right, so we've covered the solid tumors. But what about everything else? Let's round things out and talk about the cancers that start in our blood, our nerves, and a few other key places. Okay, when we talk about blood cancers or hematological malignancies, if you want to get technical, there are three main types you've got to know. First, leukemias. Think of these as liquid tumors that start in the bone marrow and flood the blood with cancerous cells. Then you have lymphomas. Now, these are different. They are solid tumors, usually popping up in lymph nodes. And finally, there's multiple myeloma, which is a very specific cancer of your antibody-producing plasma cells. And speaking of multiple myeloma, here is a golden nugget for your exams, the mnemonic CRAB. Seriously, burn this into your brain. It's a perfect cheat sheet for its main symptoms. C is for high calcium, R for renal failure, A for anemia, and B for bone lesions. You remember CRAB, you've got multiple myeloma's key features down cold. Okay, just to finish up our big tour of cancer origins, there are a few other important groups. You've got tumors in the nervous system, like gliomas, which come from the brain support cells. You have germ cell tumors, which arise from reproductive cells. And then you have blastomas. These are cancers from leftover embryonic cells, and you almost always see them in kids. So, knowing where a cancer came from, that's step one. It's the big one. But to get the full picture and really figure out a treatment plan, we need to add a few more layers of detail. Let's look at those now. First up, a really fundamental split. Is a tumor benign? A benign tumor is, well, it's not good, but it's much better behaved. The key things are that it's non-invasive and non-metastatic. That just means it doesn't invade its neighbors and it won't spread to distant sites. It basically stays put. Now, a malignant tumor, that is a whole different story. This is what we really mean when we say cancer. It's defined by two very sinister abilities. It invades and destroys the tissue around it, and it can metastasize, meaning it can send cells off to start new tumors somewhere else in the body. That ability to spread is what makes it so incredibly dangerous. This table really nails the difference. Benign tumors, they grow slow, they stay in their lane, they don't metastasize, and their cells still look pretty normal. We call that well-differentiated. Malignant tumors, the complete opposite on every count. They grow fast, they invade, they spread, and their cells can look totally wild and disorganized, which we call poorly differentiated. So in the real world, a diagnosis pulls all of this information together. You've got the location, is it lung cancer? You've got its behavior, is it still in one spot or has it spread? And now more than ever, you have its genetic fingerprint. Finding specific markers like HER2 in breast cancer or BRAF in melanoma is a total game changer because it allows for super targeted therapies. Okay, that was a ton of information, right? So let's boil it all down into a rapid-fire, high-yield review. This is the stuff you absolutely positively need to have locked in. Ready? Let's go. All right, key fact number 1, carcinomas. They come from epithelial tissue, they're the most common, and they spread through the lymphatics. Got it? Key fact number 2, sarcomas. They come from mesenchymal tissue, that's your connective tissue. They are rare, and they spread through the blood. Key fact number 3, a couple of specific ones to remember. The most aggressive primary brain tumor, that's glioblastoma. And the most lethal form of skin cancer? Melanoma. And key fact number 4, a quick look at prognosis. Generally speaking, pancreatic cancer has the worst 5-year survival rate. And on the flip side, papillary thyroid carcinoma often has the best prognosis. So you see, understanding all of this isn't just some academic exercise, it's the whole ballgame. It provides the essential roadmap that turns a chaotic, terrifying disease into a well-defined enemy with a clear plan of attack. It's truly the language of oncology. And that brings us to one final big question for the future. For centuries, we've classified cancer based on what it looks like under a microscope and where it started. But now, we can read its entire genetic code. So you have to wonder, will we eventually see a new system, one based entirely on a cancer's molecular signature, that replaces our old system based on cell of origin? It's definitely something to think about.